I want to invite everybody here to just take a moment and center in your body, ground in your body. Close your eyes even if you'd like to. I want you to think back to that dark shock during the valleys of the pandemic. Feel back for a moment the isolation, the uncertainty, and the vulnerability that was suddenly introduced into your life and into the lives of your loved ones. Compound this anxiety with a nation rising up against police violence and a president that only exacerbated the problems. What did we need that was missing during these relentlessly unforgiving moments in our lives? One thing that I feel was missing were community-led systems of resources and care. We needed solidarity. You can open our eyes back up if you close them. Early in 2020, I was driving Farm Truck 912 for the market. Farm Truck 912 is a mobile produce vehicle that delivers fresh, locally grown food, mostly to neighborhoods that are low access, low income, and predominantly Black. Before the dark overcast blanketed the entire country, I could already see that it was beginning to take its toll in certain communities. I remember being in West Savannah, and I was on the farm truck, and children were coming up to me and asking for food. Children always come up to the farm truck and ask for food. But there were a lot more than usual that day. In that very moment is when I knew things were going to get very bad in poor communities in terms of their food security. I reached out to the seniors, the ones I had been working with through the farm truck, and I heard concerns of sadness and worry and anxiety. They would often make the statement to me, "Mark, how am I supposed to feed myself?" And it was out of those conversations and recognizing what was happening that the COVID-19 Food Fund and the Senior Food Delivery Service were created. In 2 weeks, I worked over 70 hours each week to develop entirely new programs to address this rising tide. The COVID-19 Food Fund was a program for the people and funded by the people. Thanks to our donors, we were able to shift our work based in food justice in neighborhoods that largely exist in food deserts. We have to get away from using this term, food deserts. The more accurate and increasingly popular term is actually food apartheid. Food apartheid describes the racial and economic oppression that creates what we call food deserts. The dope part about the COVID-19 Food Fund is that every dollar that went to our organization, it had a dual impact. Every dollar that was donated went directly into the pockets of local farmers who were struggling due to restaurant closures. And then the food that we purchased from them went directly into food insecure homes. And we couldn't have done that without the people that we were working with in the community. We were working with the W.W. Law Community Center, the Pennsylvania Avenue Resource Center, leadership out in West Savannah, and the Student Undocumented Youth Alliance, or LaSUYA. LaSUYA pointed out which foods were culturally appropriate for their community, and we donated to them for distribution. The second program that we put together, the Senior Food Delivery Service, it's a very catchy name, I know, delivered fresh local food directly to seniors' doorsteps. Now, I had never, my entire life, formally delivered anything, let alone created an entire system that manages deliveries. But working with those coordinators at those senior residential communities, we were able to create a system where every one of these seniors got these forms, and they saw all the food that they could get, and they would write down exactly what they want, and they'd hand them in to these coordinators, and these coordinators would put them in a system, and then I would receive that, and then within 3 days, ta-da, I had a fresh bag of food in front of your door. I want to take a moment to stop and actually thank all of the volunteers, staff members, and board members who actually packed those bags. There was a lot of bags. And I especially would like to thank my colleague, Tasha Way, because without her, these programs would have not existed or succeeded. Masked up and with plenty of sanitizer. Thank you, Ghost Coast, for donating the sanitizer. We went out to deliver this food to these seniors' homes. And every single time we visited them, an intimacy began to grow. The seniors would invite us into their homes, and they would tell stories about their past lives. They would talk to us about what they cooked with the food we previously delivered. They would talk about their families and how much they miss them. They would talk to us about their isolation and insecurity. But every single time we knocked on those doors, joy gleamed on their faces. Authentic relationships were being created. Authentic relationships are transformative, not transactional. In a transactional encounter, people may, tell you about their whole lives or cry out of appreciation and what have you. I'm not trying to take anything away from a transactional encounter because they serve their place. But what made this relationship with these seniors a transformative experience was because at a certain point, I didn't have to reach out to the seniors anymore. The coordinators at those facilities, when they were transitioning into new places, the seniors reached out to us and organized their visits. What was happening in that moment was that the seniors were realizing their power, and they had a willingness to take their food security into their own hands. That's what makes it transformative. A transaction is a moment. Transformation is happening when you can completely organize an idea and create what you need. It's a system. Not only were there these authentic relationships being created, but solidarity was being established. Not only with the seniors was solidarity being established, but people that we worked with in the community during the pandemic and volunteers ended up becoming members of our board. Solidarity was present when the local farmers produced food for the community and sold it at the market when corporate grocery stores were very scary places to walk into. They still are very scary places to walk into, but that's another TED Talk. Community supported community in a way where the people most affected voiced their concerns, and then others responded directly to what those people needed. It was not the other way around, where people outside the community dictated what the people who are most affected needed. That is what solidarity looks like. The story behind the senior food delivery service, COVID-19 food fund, the transformative relationships, and the solidarity is only a microcosm of a much larger narrative that needs to be cultivated among us all. Much like what we did at Forsyth Farmers Market with our big hearts, love of our work, and with limited staff and resources, we need to create community-led systems of resources and care. I think of the words of Mama Audre Lorde when she stated, "When I speak of change, I'm not talking about a simple switch in positions or the temporary lessening of tensions, nor the ability to smile and feel good. I am speaking of a basic and radical alteration in the assumptions that are underlining our lives." If you ever got an email from me, that's at the bottom of it. End quote. As the cost of living keeps on going up and wages do not match that, as the gap between wealthy and poor continues to widen, and with the horrific news that we heard today, when people are not going to have access to reproductive health services and people can't make choices about their bodies, it becomes apparent that community-led systems fortified by solidarity and authentic transformative relationships need to be in place right now. I just don't want us to get caught off guard again. I'm not trying to create some kind of like doomsday scenario or anything like that. I just want us to be ready when bad stuff happens, because it's going to happen. So let's be prepared in the deepest way possible so that we can get to the best levels of organization, justice, and sincere human connectedness. Thank you.